Hey, happy Monday afternoon. Dr. Alan Christensen here with you, and welcome to another installment of Office Hours Live. Okay, I'm with you guys on Instagram, I'm with you on Facebook, and also on YouTube Live. So we're on a couple platforms right now. And this is a fun thing. So office hours, welcome. If you've been here before, welcome back. If you're new, welcome. I'm seeing a lot of people jump on already, so that's awesome. Glad to have you with. Uh, with these, I love to get detailed questions from you, and I love to get a conversation going about your top questions. I think that it's easy to find a lot of just general information wherever online, but it's tough to get things really individualized and really precise and really specific. And that's what office hours is about. This is meant to be really useful for you, stuff you wouldn't find really personalized. And I love to get deeper into topics as well. This is a bias I've had too. You can easily find like off the cuff basic stuff, like a lot of copycat websites or whatnot. But I want to really help this be more useful and more practical. So we'll cover the more deeper nuances of things and cover a lot more depth. So yeah, welcome. And whichever platform you're on, I'm keeping tabs on this. So I'll see questions as they come up and I'll jump on a few of those. I'm just hearing one sound is a bit lower. Can I get a sound check on anyone else from YouTube or Facebook? I am on the computer's mic right now. I'm not on my external mic. So anyone give me a thumbs up or a thumbs down about sound on those two? I'm happy to hear that, and I can adjust things as needed. So topics today, yeah, these will be topics that are of interest to you, and always curious what's top of mind. So what are the sound is okay. I'm seeing some come in all right. Okay, thank you guys for that. I'm seeing some thumbs up. Yeah, what are some of the top things you're thinking about these days for your health? What are the top goals, top questions? I've talked a lot about thyroid conditions, and I'm happy to always discuss those, but I've heard more questions about some related topics, and I'll talk about adrenals a bit today. So we've got people coming in from Egypt. We've got folks from all over, it looks like. So you're always welcome to hear where you're from. But just topics of mind. We don't have to cover them necessarily. And even if it's not detailed, just things that you're thinking about. I'm putting together a bunch of new content in the coming weeks. So I'll be reaching out in various ways. I'm always curious to know what you're thinking about, what you're wondering about, what are your top questions. I'm seeing a bunch of them come up, and thank you for that, you guys. I'm seeing these, and we'll talk about some of these right now if it makes sense. I'll also be sure to put these in our topic queues. Marilyn, Joanne, Jay, Sammy, many more coming back. This is great. And a couple of you have already mentioned questions about insulin resistance. That's great. That showed up multiple times here just in these last few minutes. I'll certainly discuss that one. I'll touch on that today, and I'll make sure that I've got that on the content calendar for more depth type stuff too. In fact, I'm opening up a tasks note for myself right now, and this is how stuff happens. So we'll talk more about insulin resistance. I'm seeing some more on iron deficiency. That's a great one. We can certainly touch on that today. I'm seeing one more about de-prescribing. Yeah, this is great. Lexi, thank you for that. I'll talk about that one today. So night sweats, I'm seeing a lot of good ones coming in. Cholesterol, yeah, cholesterol, gallbladder, great topics, you guys. A lot of good ones. Keep them coming. Keep giving me these topics. We'll cover a bunch of these right now this afternoon. And whatever we don't, I still will cover in various ways. That'll be social media posts. That'll be detailed blogs and videos. That'll be the next book. So yeah, we'll see. But I just want to make a big difference and be helpful for you guys. Just a quick recap as to why that is. If you're not familiar with me or not met me before, familiar with my work, I'm Dr. Alan Christensen. I'm a naturopathic endocrinologist. And I got into this because I was an unhealthy kid. I was pretty heavy as an adolescent. And before then, I just had a lot of problems with poor coordination, frequent epileptic seizures. I just couldn't do sports. I couldn't do physical activities, and had just very poor control of my body. And studying health, finding out answers, I realized that your health is like the biggest key towards having a happy life and being fulfilled. If your health is not there, nothing else matters. give me an amen if you've had that same experience. If you don't feel well, you can't think about anything else other than just feeling better. That's like top priority. But once you get that back again, that's the most powerful thing. That's just such an amazing experience. And I believe that the biggest tool towards regaining health is the right information. And as a child, I experienced that firsthand. I got way into health books when I was about 12. I'm seeing some hands up about health, how important that is. One quote that I've heard is that the person who has their health can have 100 goals, but the person that doesn't can only have one. They just want to feel better again. But yeah, information, books, they helped me back when I was 12. Now we get information in a lot of ways. And I've been passionate ever since about trying to figure things out and trying to figure out what's most effective, and not to be dogmatic and not to really have an agenda, but just let the data follow the data. Just look at what the best evidence shows us and then share that with others. So that's what we're about here. And I'll start diving into topics. I'm seeing gallbladder come up a couple of times. And I did have some things queued up in advance to cover, but I've got so many good questions from you guys today that I think I'll jump back and forth on those. I had some topics queued up on adrenal health and about addressing various adrenal levels. If that is a big one that's of concern and of interest today for anyone, please make a note about that. So you want to cover the adrenals. I've got some slides queued up for those, and I can share those and talk on that in some detail. And if that doesn't show up as much, I'll talk about other topics. That's totally fine. So yeah, let me know what else you want to hear. I'm seeing a lot of good ones here. I'm about to start diving in. But yeah, if adrenal health, adaptogens, using adaptogens for different levels of adrenal function. If those are topics of interest, let me know and I'll dive into those as well. But we've got lots of great stuff here. Okay, I'm going to start jumping into your questions. You guys could give me some really good ones already. Yeah, I'm hearing so much about gallbladder health. This is fascinating. I'll make a note to give more depth on that in the near-term future. That's cool. And I will touch on that today as well. Okay. I'm hearing more. So Cindy wants to hear about the adrenals. We'll talk about that, Cindy. I've got some stuff queued up that way, and I will put that to use for you. And that's enough to get me going. But if you want to put more details about specifically if it's particular adrenal symptoms or other solutions you're thinking about, I'm happy to go deeper in an area that's of your exact interest. Alternatives to adaptations, I'm guessing you mean adaptogens, because I just said adaptogens. Yeah, Liz, that's a great one. We'll talk about that for sure. So welcome. Many more just coming on. I'm about to dive into our topics here, so let's go. Okay, so I'm seeing questions on Instagram and also on Facebook and YouTube. And let me just grab this one real quick from Liz. Liz has some really good questions for us here. And this one I think is important, and I think I can address it succinctly. Liz, how to know according to symptoms when levothyroxine is too much? So Liz, that's a really logical question. And you might have seen these images that are out that show, I've seen this classic one. It shows like a woman and she's divided in half. And one half is showing hypothyroid symptoms, and one half is showing hyperthyroid symptoms. Anyone else seen that? And they talk about how hyper symptoms can include, bulging eyes, Graves' eye disease. It could include racing heart, losing weight, tremors, issues like that. And then hypo shows different symptoms, weight gain, fatigue, coldness, that image is useful, but it's also misleading. So the tricky part, Liz, is that if you're at the extremes, meaning that if too much is like 10 times too much, okay, let's say you're on like a silly overdose. Like let's say your dose is already high and you took 10 pills a day for the last 2 weeks, okay? In that case, you're about guaranteed to have classic hyperthyroid symptoms. So racing heart, you feel like you drank a pot of coffee, but you didn't just drink a pot of coffee, okay? Your heart's racing, you've got tremors, maybe you've got diarrhea, maybe you've got issues in terms of hair thinning, of sweating, all these things, just frantic, over-energized. So classic hyper. Now, I let all that up because it's rare that people take so much that they have exclusive and pure hyperthyroid symptoms. It's way more common, even if you're getting too much, that you're getting an amount that can cause a mix of hypo and hyper symptoms. like fatigue and weight gain. They can totally happen from too much thyroid. So the upshot of all that is, if you've got symptoms that aren't right, that's important. And if your thyroid's part of that, we should know about that and things should be adjusted for sure. And the symptoms are the goal. The symptoms are what matters. But it takes data to know which way you need to turn. I think about symptoms. Think about like when you're driving your car, you've got like the check engine light. Actually, I was in town a few days ago and I met my cousin and my mom, and Kieran and I were all there. My cousin's car, the check engine light was flashing. It tells you something's wrong, but there's no clue really what exactly is wrong. So we did some troubleshooting and some guessing and just ended up giving her a ride back. And her husband will come later on and take the car to the shop. So yeah, the check engine light, it's important, but it's not specific. And symptoms are like that. They're important, but they're not specific. They don't contain all that much data. Now think about like a GPS, like you got your phone and Google Maps is giving you directions, right? Turn ahead 200 yards, turn right, So that's different. And that's where labs are incredibly important. So the symptoms, they matter. We need them to improve, but they don't really direct us. Unless you're at catastrophic amounts of too much or too little, they can be totally the same in either way. So maybe that was a long answer, Liz, but you're getting too much when your labs say you're getting too much. And sometimes it even happens without symptoms. And that's where the labs help, because if the labs say you're getting too much, you could feel fine, but there still are risks you're facing longer term. And so you may not even be aware of that based on symptoms. And on the other hand, the symptoms may not tell you you're getting too much. You might feel like you're getting too little. You can commonly have symptoms of weight gain and fatigue from too much thyroid. And there's some reasons for that I won't go into in detail, but I've seen so many times where someone says, yeah, I'm wiped out, I can't lose weight. And then when their dose is lowered and corrected, they feel fine. Those things go away again. So yeah, the symptoms matter, but the symptoms are not specific enough. Let's see. Let me grab another related one here. Boy, so many good questions now, you guys. Your thoughts, please. Let me grab this one from Shida. I don't think I've seen the name before. I'm saying it right. Shida's asking, here are my numbers, your thoughts, please. One doctor says everything is okay. The other one wants to put me on medication. Thank you. TSH 2.1. I'm going to hide so we can see the rest of this. Okay, T3 TSH 2.190. I see. Free T3 2.1, T4 1.2. Okay, so Shida, yeah, great question. So the question is kind of, when do you start thyroid medication? When is that helpful? Well, so your lab results are all in what's called the normal range. And there's a lot of discussions about what's normal and what's optimal. And we've got some categories that help us get a sense about that. And for starters, let's just talk about the categories and not talk about whether or not medications, whether or not there's a real problem, whether that medications can help. Because you can have normal labs and still be symptomatic and still have things going wrong. So let's be clear on that. But when do medications help? Well, when the TSH gets above 20, no joke, above 20, and the T4 goes well below range, that's a case where medications pretty much always help. They can reduce symptoms, they can cut disease risks, they can help you feel better. When the TSH is normal, totally normal, medications don't help. When the TSH is high normal, medications can change the TSH, but they don't really improve symptoms or improve health. When the TSH is high normal or above range, we call that suboptimal or subclinical. Now, if somebody's already on medications, one could make a case about adjusting and fine-tuning the medications to help them, and that's different. But if someone's not on medications, there's now just strong consensus that unless the TSH is really high and the T4 is low, the medications don't help. Now, this is weird. This is nuance. So stay with me and just put on your thinking caps. This is a subtle distinction. So in a scenario where the TSH is above even a narrow threshold, it can cause symptoms and it can cause health risks. It can make you not feel well. And it seems so logical that in that situation, if you lowered the TSH with medication, you would then correct those problems. But the data is just undeniable that it's not true. that the medicine, when you take thyroid hormones, it's not the same as making thyroid hormones. So yeah, there would be really no reason, Shaida, to start medication with scores like that. I'm guessing the doctor read something arguing that T3 has to be on the high side of normal. And that's a view that it's based upon a simple model of thyroid function, but it's not consistent with what we see in healthy people. There have been a lot of studies looking at how thyroid scores are in healthy people, and also what happens to people at different thyroid scores. So those who always have high T3 levels, they tend to have more weight problems, more diabetes risk, and more cancer risks. So it's not really a good goal to pursue, but your scores are normal. If you did have high antibodies, that actually could be a source of symptoms. And this is a big thing that's gotten much more clear in the recent past, is that there's your thyroid levels and your thyroid autoimmunity. And it's pretty strong evidence that the autoimmune side can be a bigger driver of symptoms than just the thyroid levels. And that's one reason why so much work to chase thyroid levels with medication often doesn't help people feel better, because the symptoms are more tied to their autoimmunity. So yeah, I hope that was really helpful for you. Yeah, so those who are coming on, welcome. I'm seeing so many good topics and questions, and thank you guys for these today. We'll cover several of these, and I'll also use these for future topics to cover with blogs and content. I'm scanning through these as well. Yeah, so and I also love to get related questions, because then I get to go deeper in these topics. This might be related. Can thyroid meds help migraine headaches? As a generalization, thyroid meds can help symptoms if the symptoms come from being severely hypothyroid. And that was back to that whole thing about the crazy high TSH and the really low T4. So if that came on, if the headaches came on from that, the medications could help. Now, that's not a common source, not a common reason for headaches, and not a common symptom from severe hypothyroidism. So I wouldn't immediately think that that's a strong connection that way. I think about really trying to sort through other drivers of the migraines being more likely. Okay, Cindy, you'd love to hear more on adrenals. I will talk about adrenals here for a moment or two. Lots of interest on gallbladder. Here's some more questions on adrenal support coming in too. Frankie's with us from rainy Central Texas. So a lot of folks are de-prescribing nowadays. That's really cool. So I'll talk more about that as well. There's several questions on that. Yeah, and related questions too, looking for those. Someone saying thyroid medication caused migraines for me. RR, thank you for that, RR on YouTube. So yeah, Fran, that's true. Even if, and here's a paradox, even if medications don't help with headaches per se, if medications are not right, if they're in a dose that's more than you need, they can cause migraines and headaches. And in that case, then adjusting them could help, or stopping or adjusting could help. Not that they were the cause when they're not there, but if they're there and they're not right, they can be a driver for people, like RR was saying. So another related one that I just saw about, many are asking now about de-prescribing. Let me grab a couple of these and talk about those. Then I'll talk about adrenals for a little bit. Let's go back up. The first one I saw was a bit ago from Lexi here. Lexi, welcome back. Always happy to see you here. Lexi, I'm de-prescribing with help from my doctor. Went down to a quarter grain from 1 grain NP thyroid. Weigh 107 and I'm 66. What TSH would be acceptable? It was 3 in my last test and I feel fine. Yeah, Lexi, so this is related to our last topic we were mentioning. So this is almost like the flip side of when to start medication. It's like, when is it okay to stop? So where you are right now, Lexi, if you were not on medication, there wouldn't be a case to put you on medication. And let's say your TSH even went a little bit higher, but you didn't go to overt hypothyroidism. There wouldn't be a strong case to put you on the thyroid medication. If your symptoms are doing well, your health is good, that's all quite reasonable. Do be aware of overall autoimmune factors. Many things besides medications can make a big difference with those. I know you followed my work and done a lot of things. So you're probably covering a lot of bases that way. But where you are now, it's quite reasonable to proceed further. And those who are de-prescribing, it can take several months to have your scores level out after each dose decrease. To put some context on things for you, Lexi, if you're weighing 107, you're 66, I'll just guess that you're not on medication. I'm sorry, that you're not on hormone replacement medication. And if that's the case, for your size, your body would make somewhere around 1 grain of natural thyroid as a comparison, which is about 60 milligrams. So to take a quarter grain, that's less than about a quarter of what your body would require. So yeah, you're making pretty much all of that by yourself right now. And that last little step shouldn't be tough. Now, one of the big studies on deprescribing showed that about a third of people do have symptoms with each dose decrease. A big distinction, though, is symptoms that emerge versus symptoms that progress. So if a symptom shows up right when you step down a dose and it gets radically worse and worse and worse over like days and weeks, that may persist. And that may be a sign saying that you'd want to stop where you are and not go down further, maybe even go back a step. But small symptoms that emerge and come and go, they can be quite normal with successful deprescribing. So if you find that when you step down, you're off in some ways that correlated before with feeling hypothyroid, you wouldn't necessarily need to be alarmed. They often can come and go and not necessarily be significant, not be lasting. If they're severe and they're continually progressing, that's different. That's a sign saying stop or back up. Don't go further or go back a step onto a higher amount. But minor symptoms that show up are not really a sign saying that you've got a problem. They can be quite common. What happens is that the less you take, the more your body is motivated to make more thyroid. And it may take a few months to get caught up with that new signal. So you can always give it a chance and see how things level out that way. Related one, I saw another one about someone who's deprescribing. And just for a few quick notes, you guys, I think Lexi probably knows this, but let me back up and remove her question from there. Lexi probably knows this, but some may not. So the Thyroid Reset Diet is a dietary program that's in a book, and it guides people on getting to a targeted level of iodine. And clinical trials have shown that those who get to that level, somewhere around 95% see big improvements, and somewhere around 70 to 80% see full reversal of disease. Those are big numbers. Those are big claims. I wouldn't say those without a lot of strong evidence to back those up, but it's true. Hashimoto's hypothyroidism, non-autoimmune hypothyroidism, subclinical hypothyroidism, they've all had large trials showing results like that. About 60 to 80% of people fully reverse disease. And that's not yet taking into account those who are not compliant, or those who improve but don't fully reverse disease. If we look at those who are compliant and we include those who improve along with those who fully reverse, that's where we get that 90 to 95% number. So most folks get a lot better. So with deprescribing, that's a strategy that makes a big difference. And the newer studies on deprescribing thyroid medications, they do advocate lower iodine approaches as well. The other thought is appropriate micronutrients. My favorite right now is the daily reset bundle, and this is from Thyroid Specific Formulations. This is a blend of micronutrients that helps the thyroid really get stronger again and work more effectively and recover. It covers the basis for micronutrients, for vitamins, minerals, essential fats, vitamin D, and I'll get a link up here for that quickly. For many people, they've said that this was a big part of their deprescribing going faster. Part of it is having the right stuff, part of it is not having the wrong stuff. So it's tricky, but a lot of nutrients that are good in other contexts can be counterproductive when you're deprescribing and trying to help your thyroid work better. So that's a tricky part of it. Okay, so I saw someone else ask about deprescribing, and I'm going to take a look at that one. So many good questions coming in, you guys. I'm watching on Instagram also. Liz is asking if keto diet is good for thyroid disease. Liz, I wouldn't recommend it. The only studies out on it have shown that it can worsen thyroid function. Those are studies in kids. Kids don't normally get thyroid disease, but they sure do when they're on keto diets. Like the rate goes from 1 in 1,200 to 27%. So pretty big deal. Okay, where was the other one on deprescribing? I just saw it. Scrolling back here. There we go. This is from Frankie. Slowly deprescribing down from 1.5 grains to 48.75, which is like 3/4. After a greatly suppressed TSH, 6-year-old female feeling better on less thyroid meds. Oh, thank you. Okay, cool, Frankie. That is awesome. I thought I just skimmed it and thought there was a detailed question, but I'm totally happy to hear that report. So Frankie was on just too much thyroid medication apparently, and now she's taking half as much and feeling better for that. So yeah, thank you, Frankie. This fits what I was saying before about how you can feel off from taking too much, just like from too little. So that's great news. And related one, Melissa, anything that helps stimulate the thyroid gland, assuming it's lazy after being on thyroxine for a few years. Melissa, it's really giving it the right opportunity. And in that case, that's a matter of the right micronutrients that I mentioned, but then appropriate amounts of iodine per the thyroid reset diet. And I think you've been on the discussions before, probably aware of that part of it. I just saw a request for seeing the link to nutrients on Instagram. I'm going to pop that up. There we go. It's going to show up in the comments right now. Yeah, let's talk a bit about the adrenals. Many have asked about that. I've got some slides queued up. Okay, well, related one, Frankie, what should my range be for the TSH? So Frankie, this is a great question, and the question is different contexts. If someone is on medication, they need them long-term, that's one answer. If someone is tapering on medications, that's a different answer. And if someone is saying, hey, do I need to start thyroid medications? That's a different answer as well. As you're tapering thyroid medications, if you're staying below 20 and you're staying relatively asymptomatic, that's okay. You can give things time to let the dust settle. Now, that 20 is a big number, and that's the same number for when someone really would need to start medication. So yeah, and that's the context you were talking about. If someone's already on medication, we think about a much tighter range, like between 1.5 and 2 roughly. But during the taper process and during those first several months, you might have a lot more fluctuations, and that can be totally normal and not worrisome. Okay, so related questions, we're going to get some of these too. Someone's saying, putting her scores up, been told I need meds. From what I heard you say, I guess not. So someone's saying they've got a TSH of 2, T3, TPO. Yeah, those are not signs you need thyroid medication. those are totally normal levels, and they're barely outside of optimal for someone who's already on medication. So yeah, this is on Instagram. I can't quite make the name out of that. I apologize. But if you've not already, look at the Thyroid Reset Diet. Take a look at that bundle I put up as well, the Thyroid Daily Bundle. Those 2 steps can go a long ways. You do have positive thyroid antibodies. Your TPO is up, not catastrophically high. That's not even a smoking gun source of symptoms at that level. But to keep it low and maybe get it lower, those same steps can make a big difference for you. But you're in really good shape. I would not start thyroid medications right now. And this is the thing, you guys, this is something I'm really passionate about. Most people on thyroid medications never needed them, and they're not harmless. There was one big study that came out of Korea just a few years ago, and it was really well done. It was less than a year ago. They tracked about 1 million people on thyroid medications with about the same size of people that were not. And they got these groups where they were, in every other way, they were almost identical. The ages, the genders, the other risk factors like high blood pressure, diabetes, high cholesterol, you name it, there's totally identical groups. But those on medication had more mortality than those not. They even had the same thyroid scores. So yeah, when you're taking medicine, some people need it. There are a lot of folks that need it, and it's life-saving and changing for them. But the vast majority of those put on medication never needed it to begin with. And in those cases, it doesn't help them. It doesn't make them feel better. It doesn't help their thyroid work better. And it doesn't improve their overall health. In fact, it probably makes it worse. So I'm really passionate about helping people know when they need it, when they don't. And if they don't, how can they safely change that? And what can they help support them to change that? This is a big passion of mine is, don't take something you don't need, especially if it's dangerous, if it's not helpful, and it's unnecessary. And doctors often don't get this. Yeah, the conventional world argues that at least 85% of people don't have a diagnosis that ever warranted thyroid treatment. And I would argue that in the natural medicine space, the numbers are higher than that. So many folks here have these normal scores, and they're being told they need medicine. No, they wouldn't help. They wouldn't be a benefit. They would only cause some negative harm. All right, getting a little bit amped up there. I'll calm myself down. Okay, so as promised, let's talk a bit about adrenal health. I had a few little discussions on that. So a big thing about the adrenal glands is that they affect so many symptoms. And any symptom you can shake a stick at. Some of the big ones would be sleep issues, fatigue, mid-body weight, especially chronic muscular pain, muscular cramps. A big thing with adrenal symptoms is that they change at certain times of day, meaning they're better or worse, like on a clock type schedule. So if your symptoms, they're going to shift at a certain time, you can think a lot about the adrenals being relevant toward them. That's one of the biggest clues for these symptoms being adrenal in origin. Now, a question I've been getting a lot is, what do I do if I'm at a certain level of adrenal function? And this is important. There are distinct levels. So you can easily take a look at something like the adrenal quiz is the easiest way. This is free. This is online. It's adrenalquiz.com. And you can take a quick quiz and find out what your current level of function is. If you've had salivary tests or combinations of blood tests, you can also get clues about that. I'm sharing some images that show how to interpret those things. But yeah, first you want to know your level of function, and that can help home in more precisely on various treatments you can do. Now, the new blend is called Adrenal Energy, and this one's pretty cool because you can use the same one regardless of your adrenal level. So if you're stressed or wired, tired, or crashed, this same blend can be a benefit for you. And rather than having to change treatments, you can just change the amounts. So if you're at that first level or at stressed, just one a day works. Two of them once daily, a single dose, one dose daily can work fine. If you're at wired and tired, where we're seeing cortisol levels backward, then one of those twice a day. And crashed, the later stage, then two of those twice daily is most effective. So yeah, regardless of the level, the same blend can be really useful. And this is pretty neat. I chose a lot of ingredients that have the effect of buffering and correcting cortisol, regardless of where it's starting out. And that makes it to where you can use the same formula at many different levels. One thing is citrulline. This is pretty cool. This is an amino acid that's non-essential, but has big effects upon regulating mitochondrial function. I just saw a phenomenal question I will address about why does some doctors say there's no such thing as adrenal fatigue? Well, I'm actually one of them, believe it or not, and I'll clarify that in just a moment. I don't like the adrenal fatigue concept, but yeah, I'll make some more sense out of that. One more cool ingredient to highlight in that is cordyceps, which is pretty neat. This is actually a fungi that grows in the cocoon of silkworm moths, pretty exotic, but there's so much data about it being a safe adaptogen. And it's a food-like substance. You can think of it more like a food than like a medicinal herb. And what it does is it helps the body better store energy. That's glycogen. You do a better job storing energy in your muscles and your liver because of cordyceps. And along with benefiting fatigue, we can see that this helps make a big difference on improving physical capacity. So yeah, I'm gonna take the images off, go back to your questions. So a couple of ones coming in right now on adrenals. These are really good ones. Here's a quick one. So Pat, I'm confused with what you're saying that most people don't need thyroid medication. I had blood work done through your office and I was put on thyroid meds. Was I put on meds and really don't need it? So Pat, if my doctors or I put you on thyroid medication, that would have been appropriate. It would have been indicated. And there's a lot of factors to that. But most people is a statement that's to most people, but not everyone. And that's the cool thing about working directly with someone is that you can get a good distinction that way. So no worries that way, Pat. Adrenal ones. So yeah, farm meets table. Why does some doctors say there's no such thing as adrenal fatigue? So we've got to distinguish between adrenal fatigue and HPA dysfunction. So if I could start this whole discussion about adrenal health from scratch, it would be more congruent to call it hypothalamic pituitary adrenal dysregulation. That's a mouthful. It's a mouthful. Adrenal fatigue, the problem with that is the idea is that the adrenals get tired. The story is that you have a lot of stress, you make a lot of cortisol, and your adrenals get tired from making cortisol and they can't make it as well. Well, the partial truth is that there are conditions called adrenal insufficiency, where the adrenals cannot make cortisol. The problem is that those conditions are extremely rare. They're very rare. There are a few people per million. But this thing about HPA dysregulation is real and it's common. And it correlates with all the symptoms you think about that are called adrenal symptoms. The ones that I just mentioned, the insomnia, the anxiety, the depression, the fatigue, the pain, the mid-body weight gain, they all correlate with HPA dysregulation. And it's benefited by many of the things we talk about that help correct adrenal function. So it's a more correct term. And the big problem with the adrenal fatigue idea is that not everyone who has dysregulation has low cortisol. And the other big problem is that if it were simply a matter of low cortisol, then it should benefit people to take cortisol. But it doesn't in these cases. What's happening is if the body is low cortisol with HPA dysregulation, it's because the body doesn't want cortisol. It's intentionally making less. And sometimes cortisol can stimulate people, make them feel more energized, but it's going against what their body is trying to accomplish. So it's not making them healthier or more balanced overall. That's the big distinction. So related questions. Liz is asking how adrenals affect thyroid function. Well, that cortisol, there's a cortisol slope, which is the morning spike of cortisol and a nighttime shutdown of cortisol. And if there's a healthy cortisol slope, then your cells can absorb thyroid hormones and use them effectively. If there's not a cortisol slope, you can't use thyroid hormones as well. And that's why people can have thyroid symptoms. Some might and some might not, even if they have the same thyroid levels. So some people can become outside of the optimal range and feel fine. Others get symptomatic right away. And a big reason for that is that cortisol slope. And this is one more reason why medications aren't the magic solution for all people, because there's other factors that affect the hormones you make and how your body uses them. And the adrenals are one of the bigger factors that way. So yeah, great question, Liz. Okay, let's grab like one more. Are mushrooms and supplements high FODMAPs like actual mushrooms? Yeah, fair question. So the ones in the cordyceps I was referring to, they are a fungi. They're not categorized as a mushroom, believe it or not. That's kind of a different thing. So they're not high FODMAPs. So yeah, adrenal energy is not contraindicated for FODMAP diets. Good question though. Okay, related questions, one or two more. T Boots John, my doctor wants me to thyroid meds because I'm not in optimal range, but I don't feel bad, etc. Should I start them? T Boots John, I'm going to grab a link that talks about this topic in more detail to share with you guys, and share this with your doctor as well. If you're feeling fine and your scores are not quite optimal, let's get this here. I'm getting this link. Yeah. Then certainly just take a look at the thyroid reset diet. You can make a big difference improving that, making a big difference. Subclinical disease. Yeah. This is the one I want to put up. This is more relevant. Here we go. So yeah, T Boots John. Here's one that talks about why in many circumstances the medications aren't as helpful. So take a peek at that. If you're not at a severe hypothyroid state, they probably wouldn't improve your health. And if you're not symptomatic, they wouldn't benefit your health or your risks longer term. But as always, your decisions are between yourself and your doctor. I can't go along with those, can't go against those. Another one, related one here. What is your cortisol is lower than optimal in the morning? What can you do to increase? Yeah, Liz, great question. So in terms of daily steps, take a peek in the adrenal reset diet at either the crashed or the wired or tired chapter. They both have very specific strategies with foods and with light use. I saw your question before about things besides adaptogens. Those are two big things besides adaptogens that make a big difference, but know which of those levels you're at. And low morning cortisol could be either, depends upon your evening cortisol. And you can do the quiz too. You can go to adrenalquiz.com and find out which level you're at, but either of those can make a really big difference. Okay, maybe one last one. So many good questions, you guys, and thank you so much. Oh, Yep, Frankie, here's the link I mentioned. And actually, the person I was speaking to was on Instagram. So, yeah, I'm on a couple of platforms there. So, thanks for keeping me in line. One last one for today, you guys. Related questions. There's so many good ones, and I'm going to cover all these topics in various ways. Let's grab this one. There's a few here. I have hyper and I'm 8 months pregnant, been on methimazole, wondering if the medication inhibits vitamin K absorption. Other two kids, just up vitamin K intake, green smoothies. Yeah, Deborah, I'm not aware of issues between methimazole and vitamin K absorption. Many more concerns about abnormal thyroid levels being worrisome. And during pregnancy, things are all quite dicey and quite specific. Methimazole is not the most common medication or treatment used in pregnancy, but I'm sure there's a lot of thoughts that went into that. No one takes those decisions lightly. Also, want to stop the methimazole after I give birth. Would like to know how to get off of it safely. Deborah, take a look. Here's a detailed answer for you. Take a look at the thyroid reset diet. Now, there's the reset phase and there's the maintenance phase. So during pregnancy and breastfeeding, you need a little more iodine than you do at other stages, even with thyroid disease. But you still don't need too much, and too much is still a problem with the treatment that you're on. So take a look at the book, and during pregnancy and breastfeeding, the recommendations are to add 2 servings of yellow light foods per day. So during the normal reset phase, all yellow light foods are avoided to reverse thyroid disease and to help with that. Methimazole blocks iodine uptake, quite simply. So the less iodine coming in, the better it works, the less you have to take, and the shorter duration you have to take it. So yeah, very straightforward thing that less iodine makes a big difference with that. But you need some during pregnancy. So the balancing act is to avoid all the red light foods and all but 2 of the yellow light foods per day on that list. You want to include, 2 of those yellow light foods. You don't want to avoid all of them. But that's the best way to get that ideal amount to keep you in that healthiest range, both for baby and quicker recovery for your thyroid health. All right, Dr. C with you. Have a great rest of your Monday, and I'll see you guys real soon. Thanks again for all these great questions. I've got a lot of good things to work on, and I'll be back with you shortly. Bye-bye.